Dr. Kim here. Going into my favorite room. This is my old room, room 4. Room 3 is my new room, but room 4 is huge. We have a very special patient. This is a very healthy, active 68-year-old. I had to look up his birthday because he looks younger than me. From Taiwan. He flew here to get endoscopic spine surgery because he's got this extruded disc herniation. You can see it dribbled all the way down. He can barely walk. He's got severe weakness of both the tibialis anterior, but mostly the gastroc and hamstrings. Cannot go up on his toes at all. But when he arrived, his left foot was swollen. Turns out he had a DVT, so we had to treat that. He has an IVC filter, and because of his neurologic deficit, we decided to proceed with surgery. So we have to do a really perfect job. He came here because he wants this surgery done really minimally invasively because he's very active. And that's the new age. 68 is not old anymore. 68 is young if you stay healthy and fit. It looks like a professional athlete. Anyway, he's got this disc herniation, so we'll use the Laser Endoscopic Technique, the LES procedure. Create a little poke hole, use the spaghetti noodle dilator to enter the canal through the interlaminar approach. We'll remove that disc herniation, remove any loose fragments, make sure that his nerves are totally free, because with any kind of disc herniation, the inflammatory process of healing scars everything down, and then put a little bandaid on there. I'm really hoping he wakes up feeling better in many ways. If he can get through all this, I'm confident that he'll get back to his wonderful, busy life, playing tennis and doing all the other activities that bring joy to his life. Ooh, I like that. Hello, Taiwan. We're getting started. This is one of my VIP patients who flew in from Taiwan. So if I don't do a good job, that whole nation will be very upset with me. This just has to go perfect, that's all.
After this one?
I made a little poke hole, look how cute that is. Spaghetti noodle dilator. I'm gonna gently, carefully, with my pinky out, make my way down to the spine using a combination of intraoperative imaging. My Helen Keller fingertips, because I can feel everything. That's the inferior lamina, inferior edge of the L5 lamina, superior edge of the L6 lamina, interlaminar space, X-ray. Feel the interlaminar corner. And some of this is using the force, Luke, the force shot. Oh yes, anything? That makes sense. That I like. I like knowing that you've got something going on. So I bet you that's the disc herniation. It's not letting me push in anymore. Shot. Shot. Likey long time. Okay, now for the discography. I have the tiny little needle in there. Shot and save. Shot and save. Oh, look at that. It's a caca-poo-poo disc, just like we thought. I can already see a tiny little outline on the back. Here's the very first look. I already see pretty blue. One of the most essential pieces of equipment other than the endoscope. The trigger flex deployable curve probe. I just call it the Ellman probe, after Alan Ellman, who developed it. Look at that. That looks like ligament, but in my mind, that is a tiny little nerve until proven otherwise. Nope, it's ligament, but I'm going to still preserve it and be very careful with it. Because you know what my mom always said, spine surgery would be a lot easier without blood vessels and nerves. So I'm looking lateral toward me. I'm flipping the endoscope, looking medial, away from me now, toward the canal and dural tube, and now I'm going to rotate this little, and look at that. There's the disc herniation. Oh, really? I want to control all the bleeders because you know what? Eliquis, DVTs, blood thinners, etc., etc. So I'm going to be extra meticulous about hemostasis, among other things. Okay, I'm using the tongue of the cannula to pimple pop the disc herniation. I wouldn't be surprised if it comes flying out like a hot pimple. I know that's gross, but still. Oh, this is going to feel so good. If you don't wake up feeling better, I will eat my hat. But just like the rest of you, it's not going to come out without a fight. I can already tell. It's going to be like a little troublemaking teenage kid. I'm excited. I see how it is. Favorite pituitary. Stuck in there. But I will not be deterred. Yep. Teenage punk kid disc. Nerves everywhere. Oh, come on! Oh, oh, no! Right, whatever.
Okay.
Oh, this is going to be so juicy. Oh, no! Oh, this is going to be a massive piece.
Okay. Okay. Come on!
Oh, come on!
This one is so bratty.
Just like my teenage kids.
Your kids aren't teenagers anymore, right?
Well, when they were teenagers, you know what I mean. I still have PTSD from that.
I think you started saying that when they were teenagers.
Yeah, they were, yeah. They just grow up so fast, don't you think?
Well, I remember when you turned 50. That feels like 2 years ago.
It was. No, I'm kidding.
What do you mean he's not 50? He's 35.
Yes.
Wow, you did a
Going
lot.
on 13.
You're not you did all sorts of stuff.
Yeah.
And I slept in a Holiday Inn Express. Come on, baby.
I'm still rolling.
Oh, look at that. Look at that piece.
Come
That's the
on.
kind of piece that causes pain.
Come on.
It's hard.
Come out.
It's angry. It's petulant. I'm really glad we're doing surgery because this is the type of disc herniation that will not resorb on its own because it's stuck to the annulus. A lot of it is annulus, not just pure nucleus material. And it also makes it more annoying to take out too, for both me and your body. Here's the sapphire Homer laser. It's really controlled. It's really magical. Allows me to work right next to the nerve because it's not electrical. Oh, I hope you can see how magical this thing is. It saddens me not every endoscopic surgeon uses this because it's expensive. But you know how I am. Money's no object. So here's the other advantage of the laser. I can work literally right next to the nerve. This is covered by a thin epineurium, but on the other side of that thin membrane is the dural tube. And because it's not electrical and it's so precise, I can work right next to it without shocking it or electrocuting it. You can see it shoots off sideways, so it's a 90-degree side-firing YAG holmium laser. Feeling good, despite the forces of evil. There's the kakapupu. Okay, final check. I got all the pieces out. Ball tip feeler, probe. That feels good, that feels good, that feels good. Can I have an x-ray right here? Yep. That feels good. Oh, we gotta be careful. Blood vessels. Yep, okay, that's exactly where the disc herniation used to be. Surgery is all done. I went through this little poke hole. Now I'm gonna put on the most expensive bandaid. It's really sticky though. Maybe that's why it's so expensive. It's the stickiest bandaid I've ever seen. It's also the cutest. And it matches your skin tone too. We did that on purpose. Kind of. So, best wishes on a speedy recovery, right guys?
Yeah!